When I say we don't know, we really don't know yet.
That was the main message from Virginia's Medicaid director Wednesday as she briefed state lawmakers on what could happen to Virginians covered by the health program as a result of the recently signed federal reconciliation package, which President Donald Trump calls the One Big Beautiful Bill.
We do not have CMS guidance for 90% of this. And that's important.
Cheryl Roberts says there are 1.9 million enrolled in Medicaid in Virginia, including 600,000 covered under a 2018 expansion under the Affordable Care Act. She says most of the potential changes will be to those in the expansion category, including new requirements for 80 hours a month of work, education, or community service.
We do not have what is a work, community service, or education definition yet. And we also are not sure which things are coming to the state and which things CMS is going to give us.
Enrollees will also have to prove they've met these eventual standards twice a year rather than once, raising concerns about how difficult that process is.
On a good day, under the current system, you need a master's level college education to understand the forms, and that's with people's help.
We'll be trying to focus as much as we can to make it electronic, try to make that process as well as we can. But that's about 50%, and the other 50% we're going to have to figure out.
Lawmakers also expressed concerns over how much hospitals will lose under changes to Virginia's funding mechanism. The Virginia Hospital and Healthcare Association, which represents hospitals in the state, says it would be $2 billion annually and could lead to some, including those in rural areas, to close. While Roberts didn't give a specific number, she did agree with lawmakers who said the losses would be in the billions.
We give the hospitals now billions of dollars, so the decline would be in billions.
This time there is just a foreboding fear among all of the hospital administrators that I'm in contact with, and they're not even sure how to formulate the questions yet because there's so much we don't know.
Afterwards, Delegate Sia Price says she was frustrated by the lack of concrete projections.
We could get some hypotheticals that would at least give us a picture. We're here in summer. We're starting to think about what legislation could look like for next session, but we're kind of flying in the dark right now.
Now, the General Assembly actually still is under a special session, meaning they could come back at short notice to look at ways they could mitigate the impact of these changes. But Delegate Price says they need hard data so they know what needs to be addressed. At the state capitol, Cameron Thompson, CBS 6 News.